Positive Outlook is a show designed to reach out to HIV positive men and women and empower them to live a positively positive lifestyle. Positive Outlook is in no way conducting mockery or any disrespect to the many millions who are living or have lived with HIV. Gay Life Television is in no way promoting the misuse or non-use of condoms or other safe-sex practices. The views and interviews conducted on this program are based solely on the opinions of the host and the host's guests, who are not medical professionals, but just maybe. So please, sit back, enjoy, and laugh with us as we shine a good light on a bad thing. Welcome to Positive Outlook. I'm Robbie Aldred, and we have officially reached that point that we all have been waiting for. No, not your 15th birthday and first boyfriend, and not your O-face. Meal design. We're going to start with our first meal of the day, breakfast, which is called breakfast because we are breaking the fast of sleeping. As you sleep, your body heals, builds muscle, builds bones, and even closes wounds. So if we don't have breakfast first thing in the morning after cardio, or sex, we are no longer building muscle. We are actually burning muscle. So all that time gawking and stalking at the gym will be wasted. These two processes are called anabolism, or constructive metabolism, or catabolism, or degradative metabolism. Holy Webster's, them's big words! Breakdown. Okay, our brain knows what's going on. Our brains have to keep a healthy balance within our bodies of either building or removing. If you work out and don't supply your body with the nutrients necessary, your body will take what's available on hand: fat, muscle, and even organ tissue. If you work out and have the fuel your body needs, then it'll simply use that. Now, before you all scream, "What the heck?" let me get a little deeper. When our bodies are in an anabolic state, we are building muscle and burning fat. When in a catabolic state, we are burning fat and burning muscle. Holy confusion! Okay, breakfast. Our bodies have been preparing ourselves to wake, and we must break the fasting of sleep. Again, why it's called breakfast. To stay completely anabolic, we need to first jumpstart with morning cardio first thing. Okay, after that, we need to fuel. But with what? Put down the cereal bar. We need a balanced meal that includes fast-absorbing proteins and slow-absorbing carbs. A protein shake with whey protein, as well as some whole grains like oatmeal, will do the trick and hold you over. Here's an example of what I do. Licuados, or a Central American style smoothie. Take a half a cup of low-fat milk, I prefer almond milk, half a cup of ice, 1 teaspoon vanilla, 1 tablespoon sugar, preferably raw or organic sugar, 1 banana, and 1 whole egg. Toss in a blender and blend until smooth. Straight delicious, yo! Pair that with peanut butter sandwich on whole grain bread or even Nutella. The article at medicalnewstoday.com titled, "What is Metabolism? How do Anabolism and Catabolism affect body weight?" gives more in-depth information on these two reactions.
Positive Outlook is brought to you by Astee's South Hills Pharmacy. Astee's South Hills Pharmacy, Pittsburgh's full-service pharmacy and HIV specialists.
Hello guys, and welcome back to Positive Outlook. Today I'm hanging out in the office of a Dr. Chuck Christian of PATF, or Pittsburgh AIDS Task Force. We'll be discussing what the task force does for Pittsburgh and how strategies are affecting HIV. Chuck, thank you so much for being with us here today.
Sure, it's great to be with you.
So how long have you been with PATF?
In July, it will be 3 years.
And before PATF, what were you doing specifically?
Before PATF, I was pursuing a doctorate in public health, and I ended up connected as Director of Operations for the Center for Healthy Environments and Communities at the University of Pittsburgh. And before that, I was working as the HIV administrator for PERSAD Center, the LGBTQ Counseling Center here in Pittsburgh.
Now, have you had any personal interactions with HIV? Anyone in your family, friends, or anyone that you've seen affected by HIV?
Sure, I've had a number of friends that have been affected by HIV, and I've known people who are HIV positive. I was a gay man out in the early 80s, and it was hard not to know people who were HIV positive.
And so you said you were a gay man in the 80s. Was that here in Pittsburgh?
Yes. Mm-hmm.
Okay, and so I couldn't even imagine. I know, in the larger cities, you had such huge groups of people with HIV. I couldn't even imagine Pittsburgh, being stuck between, I always say Pittsburgh's one of those towns that's stuck between Philadelphia and Chicago.
Right.
And so, everyone there, it's a big deal, but here it's not a very big deal. Like, what were some of the views of HIV
It's
then?
interesting, Pittsburgh, because, Pittsburgh was one of the first major studies of HIV. The Pitt-Men study was really led by Dr. Charles Rinaldo, was really one of the first major studies in the United States looking at HIV. So very early on, Pittsburgh had posters and people working in the bars to sign people up for this new study to study HIV in gay men. And then that study continued to evolve, and now there's 5 cohorts that make up the MAX AIDS study throughout the United States. So it is interesting that in Pittsburgh there is this sort of silence about HIV in a very large way, but yet we were one of the leaders in research through the University of Pittsburgh in HIV.
Yeah, and something isn't. Somebody told me that Pittsburgh specifically and the University of Pitt is like the third biggest research organization in the United States.
Absolutely, yeah.
Yeah, and that's, like I said, that is, you nailed it when you said, it's so silent here. It's crazy how silent it is, but it's such a hub for HIV and research.
Exactly.
And so how PATF, how are they specifically working with the University of Pitt, and just going over some of their strategies for their fight against HIV?
Well, we're connected with the University of Pittsburgh. We work when we can with the SILK project, which is a project that tries to provide HIV prevention to street workers as well as young African Americans, black men, and women. We've worked with the University of Pittsburgh on our SAMHSA project. We had, for 5 years, we were funded by the Substance Abuse Mental Health Services Administration for a project targeting gay men with substance abuse risk reduction interventions as well as HIV prevention interventions. And the University of Pittsburgh provided the evaluation component for that study. The University of Pittsburgh also worked with PATF in previous years on a needs assessment in the HIV community and looking at what are some of the issues going on with HIV, what are some of the issues going on with gay men and the relationship between them. So we've had a very strong relationship with the researchers at the University of Pittsburgh.
Mm-hmm. And I come here. PATF they have helped me from everything to finding friends, to food. I've come here, and just like many other organizations where I was getting my medication and getting my care, it was all open arms. And I've noticed that through my volunteering, I constantly see I'll see posters for all kinds of events that are coming up, and I see PATF literally stamped on there. You guys sponsor so many events here. Is there any specific events that you are targeted? Is there something that says, hey, we need to sponsor this event, we need to jump onto this?
Well, I don't know if there's any. We have a number of things. Certainly Pride and Pride Fest is at the heart of who we are. Mm-hmm. It was Kerry Stoner was a gay man who died of complications of HIV. There were lots of people throughout the years who have been supporters and still continue to be supporters of PATF who are gay. So the gay community is very much aligned with PATF, and we like to have a very strong presence at Pride Fest. We usually have a float, we have a table. We also, at the end of June, we sponsor an East End Community Health Fair in recognition of National HIV Testing Day. This year, of course, like last year, WAMO is a partner with us. And WAMO, for the whole month of June, advertises this event with the understanding that it is an event that is also promoting HIV awareness and testing. So we hope to get people into the office here to be tested for HIV as well as other STDs. We have World AIDS Day. We work with the Delta Foundation, who coordinates a number of different service organizations to bring awareness to HIV and AIDS through activities connected with World AIDS Day. And one of the activities that we are very much involved with is the house ball community, the Pittsburgh house ball community. And for 3 years in a row now, we are producing World AIDS Day Ball that we're very proud of. We're looking forward to this year. We've already been planning this year for the ball that'll be happening around World AIDS Day.
Positive Outlook is brought to you by Astee's South Hills Pharmacy. Astee's South Hills Pharmacy, Pittsburgh's full-service pharmacy and HIV specialists.
Finding out you're HIV positive can be scary. Was for me. I was terrified. But then I realized that it's not the end for me, and it certainly isn't for you. My name is Robbie Aldred, and watch my show Positive Outlook, where we learn why it's no longer called surviving with HIV, but thriving with HIV. Being completely upfront and honest with your health professionals, with your doctors, saying, hey, this is what I'm doing. They're embarrassed that they're going to judge them, and it's like, well, no, I mean, that's how the doctor can know. It's like, okay, well, does he have a risk for this? Does he have a risk for that? Right. Syphilis, I mean, you get syphilis just by simply touching it. And I see this is something that I just learned, because you got to think, my generation, syphilis is, of course it is a big deal, but this isn't the 20s or something when it was an insane amount of it. But I didn't know that. I thought syphilis was something that you caught the same way you caught HIV. It was through ejaculation. It was something that was in your bloodstream. But no, it's if someone has a sore anywhere on their body and you just simply touch that sore, you just caught syphilis. And so many people don't seem to realize that. They think that, oh, okay, yeah, I'm positive and I've got really nothing else to worry about. And it's like, well, no, some of the really big boys, it's just simply syphilis lies dormant in your body for something like 15 years. It's some ridiculous amount. It's such a silent killer, and so people don't hear about it. So they're like, oh, okay, I'm perfectly fine, but they don't realize that, you can get this still. You still can catch this.
Right. Well, I think the issue, and we see this around HIV too. The issue is we tend to be a very pill treatment oriented society. So in other words, we're more on the pill side than we are on the prevention side. So in other words, so syphilis and gonorrhea and chlamydia become less potent, shall I say, sexually transmitted infections because we have very effective treatments for them. So, a round of Cipro, will take care of a syphilis or a gonorrhea infection, and, especially if caught early. If caught much later, it gets much more difficult, the treatment, but yet there is treatment up to a certain point. And HIV, I think once medications really showed to be efficacious and worked well at allowing people to manage the disease in their body and live fairly normal lives, all of a sudden HIV now gets into that realm of, well, there's a treatment for it, so I really don't have to worry about it.
Exactly.
And it's great that we have very effective treatments for HIV. Again, there'd be no reason to test for HIV if we didn't have an effective treatment. But we do, and it works very well. Granted, like any medication, there can be nasty side effects. Nobody likes to have to take a pill at a particular time with or without food, and thinking about that and knowing how to store medications and etc. So it is difficult to live with a medication regimen, but at the same time, when you do that and the medication works so that you live your life, you can work, you can have a family, you can do all the things that most people do, it's kind of nice. But with that, the fear of HIV goes away for a lot of people. And therefore it doesn't get talked about, it doesn't get acknowledged, it's a chronic illness that folks kind of go, well, okay, it's there, and I don't have to worry too much about it.
Yeah, and that's with me, like some of the strategies that I try to do. I mean, I'm just one guy. I'm just one guy with HIV going around trying to talk to people about HIV. But that's one thing. That's one strategy that I've done. One, it's for my own personal gain. It's like I was saying to Mike Helmy when I hung out with him. I tend to internalize things, really deeply internalize them, and then I just lock myself into a depression. And so I have to constantly vocalize things, because the more comfortable I sound, yet again from my music training, the more comfortable I sound, the more comfortable it makes me. And so one of my strategies is I always just try to tell people just to not be afraid, just to realize that yes, it's there. And I know you and we discussed that, and I had even said that I wanted people to be a little afraid. And I remember you and one of your colleagues said, no, like we want to get rid of that fear. And so what are some of the strategies that they did use that failed, and what are some of the hopes for strategies that we can go into to battle HIV specifically?
Well, I think early on, strategies that tried to promote fear worked to an extent, but we've also learned, and as we were talking, I think the example of the motorcycle helmet law gives this example of, you have people have values on things, and those values are on a scale of, what would you give up to not have to have this value. And what I mean by that is, so we have motorcycle helmet laws in a number of states. Pennsylvania is one, and that motorcycle helmet law is you don't have to wear a helmet to ride a motorcycle. It wasn't that way some years ago. The law was you had to wear a helmet, and it was for the same reason that we wear seatbelts. So
Exactly.
It was to protect individuals. But there are a lot of motorcycle riders that lobbied and said, look, it's our right to ride a motorcycle without a helmet, and we don't need the state to tell us how to protect ourselves. And so that helmet law was repealed. So here's the education. So the education is out there, the information, the statistics are all there that says if you ride a motorcycle without a helmet, the chances are high that if you're in an accident, you're going to come away with a severe brain injury or death. So people will know that, but yet when their value scale is such that the riding of a motorcycle without a helmet is highly pleasurable and highly desirable, the risks associated with it then become lower. So my decision is that I'm going to ride a motorcycle without a helmet. We've allowed people that right. It's the same with sexual behavior. Sexual behavior is a pretty high value for a lot of people. It's pretty hardwired into all of us because it allows the species to continue to promulgate. So we find sexual pleasure to be really good and really positive. And I agree, it's a great thing. And then we tell people about the risks of engaging in sexual behavior, like anal intercourse without a condom and ejaculation associated with that. When you're doing that, that person who is receiving is going to be a really high risk for a possible HIV infection. So we know lots of people have that information, but when you combine that with the pleasure of having sex without a condom, you combine that with substance abuse, so you're going out to a bar and having 2 or 3 drinks and now you're inebriated, decision making becomes a whole nother level. And you put those two things together, and then you might add love on top of that. So now you've met Mr. or Mrs. Right, and you want to have sex together, and you want to have sex with the highest amount of pleasure. Now, you could argue that using a condom would give you the highest amount of pleasure, because with a condom, you're free to do whatever you want because you can feel safe.
Yeah, exactly.
But at the same time, some people find that as a barrier to their lovemaking, and so they want to not use a condom. It could be as simple as being too high and forgetting.
Yeah.
So what I'm trying to say in all of that is that we place values on things, and a lot of times those values may be higher than the risk, and so we ignore the risk, and sort of interiorly we're thinking, okay, it's not going to be me.
Yeah.
You know, so today the strategy is, we've realized we can talk to people till we're blue in the face about using condoms and preventing the risky behavior that can lead to HIV transmission. We can talk to the blue in the face, but it really hasn't worked. We've been sort of level for 20 years in terms of new infections and deaths. We're not going down in terms of, so the more education we've had, we're not seeing this dramatic drop in HIV cases. There's been some. Mm-hmm. It does work to an extent, but the national strategy, after talking with scientists and looking at the research and talking with people that have been doing prevention work for years, the Obama White House put out this strategy that says, you know what, our best efforts need to go towards finding all the people who are positive. And so that goes to where, if we can test people routinely when they go for health care, we go a long way to finding those people who are positive. And then breaking down the barriers to access to care, to move those people who are positive into treatment so that they're on medications. The medications can reduce a person's viral load to undetectable.
Positive Outlook is brought to you by Astee's South Hills Pharmacy. Astee's South Hills Pharmacy, Pittsburgh's full-service pharmacy and HIV specialist.
In closing, to go ahead and start wrapping this up, what do you want to say just to people specifically, one, how to prevent themselves from getting HIV, and what to do when they will think they've come in contact?
Well, I mean, certainly to prevent HIV, it's first of all learning and being aware of how HIV is transmitted. Using a condom is very effective, and using it properly, that means with a water-based lube. Oils and things like that disintegrate a condom. Mm-hmm. So using a water-based lube with a condom is a very smart thing to do. If people aren't going to use a condom, then know that there are ways that not ejaculating in somebody in the vagina or the rectum is a way to protect somebody. So pulling out beforehand is a way to try to reduce the amount of, as you say, the seminal fluid that would be in contact with a blood-rich area of the body, because HIV has to get into the bloodstream.
Exactly.
I mean, that's the issue here, that skin is a very preventable way to get HIV. So it has to get into the bloodstream, and the vagina and the anus are blood-rich areas. Mm-hmm. And that's why injection drug use is another way of contracting HIV, because you're injecting blood from a needle into your bloodstream, and it's direct contact. So people that are using needles to inject drugs, making sure that they're using a clean needle and disposing of that needle afterwards is the best way. If a person has to be shooting and they're shooting with other people, then being the first on the needle is probably the wisest thing. You don't want to be last in line. Just having an awareness of those things is really important. So, I mean, those are effective ways to prevent HIV. And I think for people who are HIV positive, really understanding that it is a difficult disease to manage. Any disease is difficult, but there's a strict regimen that has to be adhered to. Sometimes people aren't in positions that they can do that very well. But I think they need to know there are places like PATF. We do case management. We have supportive services. We try to address housing issues, transportation issues, legal issues, all those things that can be complications to people being able to take the medications that they need to do. Know that there's free care. The Positive Health Clinic, the PAC Clinic here in Pittsburgh have our Title C Ryan White funded clinics that can provide free HIV care to folks. Our our SBB, our Special Pharmaceutical Benefits Program, the 340B program, PATF has is a 340B covered entity, can supply medications for people, especially in low income, free of cost. So, you know, the care, the treatment, the medication, it's all there, it's available. Whether you have insurance or not, you can get the care that you need. And it's just so important to work with somebody like a PATF that can help you, like PAC Clinic, like Positive Health Clinic. Macedonia Face is another one. These places where people are set up to provide you with the kind of help that you need. Take advantage of it.
Fantastic. Well, Chuck, thank you so much. Thank you so much for being here with us. It's been very enjoyable, and I definitely look forward to seeing some of you guys out and just some of these events. It always, as I said, it always makes me so proud volunteering for these events, and as I said, seeing that PATF stamp on so many events. It's
well, we
wonderful.
appreciate it. We want to be there, and congratulations on the positive outlook in this program. I think it's a wonderful thing for the community and for the nation. So thank you for your time and energy too.
Absolutely, absolutely. All right, guys. Well, thank you again for tuning in. Again, know your status. Do everything you can to just know your status. If you are positive, get on medications, become undetectable, educate yourself. If you're negative, educate yourself. Knowledge is power, and it's really the only thing we got.
Positive Outlook is brought to you by Astee's South Hills Pharmacy. Astee's South Hills Pharmacy, Pittsburgh's full-service pharmacy and HIV specialists.
Today, we're taking a bat to the knees of stigma with a healthy dose of truth. Guess what? We humping. A lot. Like a lot. I've had many people ask me to cover the one thing that's on everyone's minds, or in their medicine cabinet at least, and that's pre-exposure prophylactics, or PrEP. Totally bombed that. PrEP is just simply a drug used prior to possible exposure with HIV, like with serodiscordant couples, or couples in which one partner is HIV positive and the other is not. The drug will actually prevent the user from becoming infected with HIV. But of course, it's already been set ablaze by bigots and politicians. Just like when birth control was released, many are associating the drug with rapid increase in sexual activity amongst the gay community. Which is true, but why is this a bad thing? Who wants HIV? I don't want HIV, but hey, I like dudes, and this one dude, this one time, was not an honest dude after we did dude things with our dude parts, and well, here I am with you dudes. PrEP has been found to reduce the rate of infection by up to 92%. And when used with condoms, you are practically a shield from HIV. A statistic that's pulled right from the CDC website itself. Now, Truvada only works if you completely adhere to the rules of Truvada. And that's to take the medicine every day. I've been positive for over 5 years now, this past July 9th, and I've taken meds every day since then. And I have to say, it's annoying. But hey, it's one of the best defenses we have so far. Okay guys, to wrap everything up, we covered slightly on the difference between staying catabolic and anabolic when building muscle and burning fat. Sounds slightly confusing, but it really helps when you can control these reactions. And be sure to check the website for a better idea of these reactions and how they affect metabolism. We also chatted with Chuck Christian from PATF, who is not only doing awesome things here in Pittsburgh, but is also a super awesome dude. And guys, PrEP is not a bad thing. And referring to yourself as Truvada whores, not cool, bro. Guys, thanks so much for watching. And always remember to add me on Facebook, facebook.com/Cyrobius. Follow me on Twitter @Cyrobius. And shoot me an email at positiveoutlook@gaylifetelevision.com. Who knows? You may get to chat with me on one of my shows. And remember, if you're negative, stay negative. And if you're positive, keep people negative. Have a great day, guys, and I'll catch you next week right here on Positive Outlook.